Ahead and get started. And I want to welcome everybody to the first public health preparedness webinar of this academic year. I'm really excited to have somebody from Penn State who is, I've known Michelle for a good number of years now, and she's my commencement buddy. And she's going to be talking about ethics in public health, which is really important. And it's something that I have wanted to feature in our webinar series for a while now, and it just hasn't come to fruition. And then Michelle and I were just having a random conversation one day, and she offered to do this. So I'm so grateful to have her. Before we get started, I just want to make a couple of quick announcements, which actually just reminded me of another one. So first, we do public health preparedness webinars on the first Wednesday of every month. We send out calendar invites. It's in our public health preparedness LinkedIn group. I've done some outreach with some different public health related, emergency management related student organizations. So we try to get the word out as much as we can. So if you are not getting them and you want to find out about the upcoming ones, please reach out to me. I can definitely make sure that you are on a distro, and we will get that information to you. But as far as the PHP webinars, they're the first Wednesday of the month during the academic year. We take the summer off because people's schedules are crazy. We also have a student emergency management club. We had a lot of interest in emergency management and started it's a club for students, faculty, alumni, anybody in the greater Penn State family who's interested in emergency management. And those are always the second Tuesday of the month. Those go year round. And our next meeting there is going to be on the 9th. All of these are at 8 p.m. Eastern time, by the way. And then also, another idea that came out of a random conversation that I'm also very excited about is we have started a public health/public health preparedness book club. And the first meeting is going to be on, I believe it's the 15th. It's the third, yes, the 15th. It's the third Monday of the month we're going to shoot for. And this to kick it off, we're going to be reading 5 Days at Memorial, all about the hospital in New Orleans during Katrina. It has public health tie-in and also emergency management tie-in. So we figured that for our first attempt, we would do that. Also, in my PHP 410 class, students will read an excerpt from it. And actually, it's not an excerpt, sorry, it's a newspaper article that the author of the book also wrote. And we do a discussion forum that people really are interested in. And even though it's a little dated now with the 20th anniversary, it's still something that people really feel passionately about. A lot of people remember and talk about. I've had students in classes that when they're doing the discussion forum, they talk about their personal experiences during the response. So it's always an interesting topic to explore. So again, book club, third Monday of the month. November 3rd. I don't have many details on this, so this is more of a save the date, and maybe Michelle, if you know anything, you can help me out here. But the College of Medicine is doing an alumni event in DC. It is in conjunction with, I will say, the APHA conference, but you don't have to go to the conference to go to the event. Do you know where it is?
It's tentatively at Yardbird, but we don't have final confirmation yet. So we're not sending out. As soon as we have confirmation that the space is booked, we're going to send out a save the date and probably an RSVP link just so we have a general idea of numbers.
Okay, so as far as save the date right now, November 3rd in DC in the evening. So if you can come, we would love to have you. I'm not going to the conference, but I am definitely coming up for it. So if you are available on the 3rd, we would love to see you there. And finally, there is somebody that I met, speaking of random conversations, on LinkedIn who he does a lot with veteran mental health and video games. And he started video games are a great way for veterans to have a community, have an outlet, and he has done a lot in the veteran mental health space. And he reached out to me about a week ago. And there is a veteran mental health suicide prevention conference that is going to be held at Fort Belvoir at the end of this month. It's going to be on September 27th. And he was looking for a couple Penn State students to go to the presentation on the 27th and to write a white paper on it. He thought it was something that would be interesting if if we wanted to participate. So if this is something that you would be interested in, please let me know. You don't need to have a CAC or anything to get on Fort Belvoir. There, where the conference is being held, it's accessible. So please let me know. He's got samples of previous ones that he's done, so you'll have a have something to work off of. And it's a great cause. He does a lot of great work. I'm still hoping that I can go. I'm just trying to work out some scheduling things. But if you are interested, or if you know somebody who's interested, please get in touch with me or have them get in touch with me. I would love to be able to support this effort. Okay. So the I'm really excited before we turn to Michelle. As I have been taking over the role of Director of Graduate Education in Public Health Preparedness, I have been learning so much about all of the little pockets of public health that exist at Penn State. Um, I'm the faculty advisor for the Emergency Management Club. So I was on the portal one day, updating our club registration, and I just started doing some searching. And there are a number of public health related organizations, and we have some representatives from FAYS here to speak tonight, just to give a quick overview. So Logan, one of our PHP students, who's still at Penn State doing amazing stuff. Do you want to take a few minutes and talk about this?
Yeah, sure. If you could have, can LaRob share her slides for the face? Ah, cool.
Yes.
Yeah.
Amazing.
And I'm
So,
sorry, I didn't see that you were logged in. Logan and I were busy talking, so sorry to turn it straight to Logan.
No worries. I think Logan can present it. Hi, everyone. I'm Lareb. I'm the co-president for FACE, and it's Public Health Association for Service and Excellence. And these are the slides that we use for the fall 2025 orientation week, which all the incoming students had. So Logan can take a lead on explaining what we do.
yeah, so FAYS is our public health student group at the College of Medicine. We do a lot of events, thankfully. Some of these events are, we have faculty come in and they'll talk. We'll have alumni talks. We'll have a few socials throughout the semester at the College of Medicine. But one thing that we're really hoping to do this year is reach out to, extend our welcome to, World Campus students, PHP students, things like that. Because we all need to band together in these trying times, but we do a lot of community service as well. We like to pride ourselves on the work that we do in the community, things like the Ronald McDonald House or Cocoa Packs, which is a local food packing thing. You can see some of these events. We really just try to be active on campus to represent public health. So here are some of the things that we did over the last year. So we had a fundraiser because funds are tight for everybody. And we were able to use those funds to sort of, fund our socials. So we were able to do something really cool for public health graduates. A lot of the MPH students and IUG students we were able to throw like a little celebration dinner to celebrate their accomplishments. Um, and here are some of the pictures from that. It was really fun. It was really exciting. Uh, I think that regardless of where you are and what level of education you obtain, it's incredibly impressive, and it's something that we should all be excited about and support each other through all of this. So we actually do have an event. I realize it's pretty challenging for a lot of people to come to the College of Medicine. It can be quite the drive if you don't live in Hershey or the surrounding areas. But for those that are interested and are around or feel like driving from UP down to the College of Medicine, we are hosting an ice cream social next week at the ASB, and that's 90 Hope Drive. So we're really excited, hoping to get a lot of the new students, hoping to get some faculty there that you can talk to. It's just going to be a lot of fun. And we're also looking for officers for the next this next year. There will be some openings as some of us transition to other things. I'll be staying in phase. Who knows what my next role will be? But I'm excited to see. We have a group me that you can scan that QR code, and you can reach out to LaRob. There's her email, and mine is lfox7. Feel free to reach out to me. I'm always happy to answer questions, give advice. So yeah, that's what phase is about. So feel free to reach out with any comments, questions, anything like that. I'm happy to talk to anybody.
Thank you. And I just joined your group me group, so thank you for the link. And I just sent you a message, Logan, also. When you do your merchandise sale later this fall, please make sure you send me the information, because I will probably buy way more than I need, and I will be sure to send out the link to all of our PHP students. And you also reminded me of one important announcement. I apologize, Michelle. I got some requests from students for some sort of in-person activity. So there is a flu shot drive in Lebanon that the hospital is going to be putting on, and they would definitely be interested in any sort of student volunteer support. It's October 4th. I believe it's at 9 o'clock. I'm going to be sending the registration link out. But if you are available and interested, I was planning on driving up for that. So if you are interested, I would love to spend the morning with you. October 4th in Lebanon. And that was really my last announcement, Michelle. So now I am super excited to introduce Michelle. I'll let you talk about your background, but Michelle is one of our awesome PHS faculty, and I'm so excited to have you here tonight. Thank you.
Thanks for having me. No worries at all about the announcements. I'm actually one of the phase faculty advisors, so I'm totally happy to have them talk to as many students as possible. I think it's great that they're starting to integrate more of our online students, so hopefully that goes well. But let me share my screen real quick. I do have some slides. Okay. And full disclosure, I'm a pretty casual presenter, so if at any point you want to interrupt me for some reason, you have a question, you want to share something relevant, please go ahead and do so. That won't bother me one bit. So my background, I'm currently the director of our Master of Public Health program here at the College of Medicine. We have some students in person and some students online now through World Campus. I was not an expert at all in public health preparedness. I'm kind of a public health generalist, honestly, but my main focus has been health education up until now in my career. I'm a certified health education specialist, and so I'm very focused on the health education aspect. Makes sense that I'm in academic public health and educating. Today, I wanted to talk to you, as Jen mentioned, we kind of talked about this offhand after graduation this year, about talking to the public health preparedness cohort about ethics. And it's something we do in the MPH program, but I think it's something we need to do in general more than we have been, because it is really important, especially with, the really difficult time we're having in public health and, governmental public health and any area of public health. it's really important to make sure that we are acting in a way that is ethical and is serving the people we are, kind of mandated to support. So we'll do a quick ethics overview of some of the basics. We're not going to get super detailed because that would take a long time, but we'll talk a little bit about ethics. We'll talk about some case studies and kind of apply the ethical principles we talk about first to those case studies. And then we'll finish by talking about some ethical decision-making steps and considerations for ethical decision-making. So ethics in general, shared rules of correct conduct. What's right, what's wrong? It's very much a societal construct. It is something that we agree upon as a society is a thing. And these are the things that are right and wrong. And for that reason, it's very context dependent. So in different contexts, we'll have different ethical rules. For example, we have, medical ethics, we have business ethics, we have public health ethics, we have any number of things, research ethics, and they all have their own rules of conduct, right? There's going to be overlap. Sometimes they'll contradict one another. Sometimes in one context, something will seem ethical, and in another, it will not be. There's lots of examples of how, depending on the context, there are conflicts in what is ethical versus not. And, it's really important to have multiple perspectives when you're talking about ethics, because you need to come to a shared understanding of what is right. We can't just assume that everyone is going to agree, because no one ever agrees on anything, right? But we have to come to some kind of shared understanding. And that's where ethics versus morals is really important. So morals are very much your personal beliefs, your personal moral rules, your guidance, your judgment. That can be based on your personal experiences, your religion, your upbringing, any number of things that are very personal to you. Ethics, again, is more of that shared understanding as a society, or as a group of professionals. As I said, we have research ethics. People doing human subject research have decided these are the ethical principles. They've agreed on these, regardless of their own personal morals. And sometimes your personal morals will be in conflict with what is ethical in your profession, in your, culture. It can be different, which is something you'll have to deal with, which is, again, why those different perspectives are really important, because you want to make sure that you are not making a decision on what's ethical for everyone just based on your own personal opinion, right? So a lot of what public health ethics is based on is bioethics and modern bioethics. We won't go into the full history because it is long and very ugly, but we've come up with, rules of modern bioethics based on a bunch of really horrible stuff that happened in history, and then not too distant history, right? So, the big thing in the US that spurred a lot of this was the Tuskegee syphilis study. I'm not sure how familiar folks are with that, but basically, a large group, hundreds of very poor or homeless African-American men with syphilis were brought into a study by the National Public Health Service to study them and study the progression of syphilis. At the time they entered the study, we didn't know that you could just give them some antibiotics and cure syphilis. We found that out a decade or so later, and they were not treated. We let it naturally progress until the 70s. So these men were suffering from syphilis for decades, with it getting worse and worse, having neurological implications, things like that. And it only really ended because it became public and the general public knew about this and there were news articles. And so there was public outcry, and we, bad that you can't be doing that. So that's really where the most modern bioethics comes from, is, we've done stuff in science that is not good. We've done stuff in public health that's not good. And now we need to have these safeguards in place, these guiding principles, so that we can make the correct choices. A lot of this feels like common sense, but it's still necessary to have these principles and theories and rules. So modern bioethics has 4 main principles. There's beneficence, which is 2 parts. You need to bring benefit with whatever you're doing, whether it's research or an intervention or, planning for preparedness. You need to bring benefit, and the benefit needs to outweigh the risk, right? We have non-maleficence, in the Hippocratic Oath, first do no harm. We need to not be causing pain, death, other, negative outcomes. Autonomy, that's where we get this respect for persons concept. People need to be able to make informed decisions, free from coercion and distress. They need to be able to make those decisions on their own, and they need to be informed. Informed consent is very important in research. Same thing, we see it with disasters and emergencies. We saw with COVID, people were being told to do things, but they weren't sure why. There was confusion, and that causes pushback, right? People need to be able to make informed decisions. And then justice. So equity versus equality, and making sure that the decisions we make are as equitable as possible. You're never going to be perfectly equitable. It's just not feasible in reality, but the best we can do. Additional ethical principles that are really important for public health and public health preparedness are integrity, being honest and transparent, again, to maintain that trust. When we're dealing with the public, we have to maintain trust. As soon as that trust erodes, whatever we're trying to accomplish becomes so much harder. And then fidelity, adherence to commitments. And this is often, looked at from a governmental perspective, right? The government has an obligation to take care of the citizens, right? We should be taking care of folks after disasters, after, mass casualty events, after bioterrorism, after whatever may occur. The government should be providing certain services and funding whatever else to support people. So these are the really important principles. There's a lot of ethical principles. These are just the ones I'm highlighting today because there are far too many to go through. You might notice some of these might not always go completely together, right? So some of these will be in conflict with one another occasionally. And that's difficult. And it's just one of those things where in ethics, a lot of it is weighing things against each other. What is the benefit? What is the risk? Yes, this is a downside, but what is the upside? So 2 ethical theories, there are a lot of ethical theories. We're not going to get into all of them, but 2 that are most often applied to public health and other things you might experience or encounter with public health preparedness are utilitarianism and the social contract theory. So utilitarianism, and another side note, there are probably 18 sub theories within all of these where people branched off a little bit because they didn't like the main theory and they wanted to modify it. But so I'm just talking about the basic kind of theory here, but utilitarianism is really the outcome is most important. Creating benefit or reducing harm is the most important thing. And you're looking to do the greatest good for the greatest number of people, which on its face sounds awesome. But also, if you're doing, pure utilitarianism, it's very much an ends justify the means kind of concept, which, as we know, is not always the greatest because sometimes you can do bad things trying to do something good. So you won't ever, I can safely say this, you won't ever just strictly use one ethical theory as it is for anything. You will probably use pieces of ethical theories to help guide you, and you're not going to explicitly do this. You're going to be inherently doing this based on your own values of what's most important as you're approaching these different decisions and these different planning opportunities. The social contract theory is one that's also very important. for public health and public health preparedness, because this is all about basically followers and leaders, the government and, citizens. This is all about giving up a little bit of autonomy for a benefit, right? So we give up some autonomy to the government for the perceived benefits that we're getting. For example, you can't smoke in restaurants. Most places. There are some places, but most places you can't smoke in restaurants, right? We're giving up a little autonomy there. But the benefit is we have far fewer people getting, pulmonary cardiovascular diseases from secondhand smoke. So that is the benefit. So there are lots of ways that we give up autonomy. These can be small or large, and it depends again on the context, and receive benefit from figures of authority, whether it's local government, federal government, different agencies. We do that a lot. And the social contract theory really relies on implicit and explicit contracts. So those social contracts, explicit contracts are laws, things that are explicitly written out, don't drive drunk, bad thing to do, it's wrong. So we have a social contract that is explicit. Implicit are don't cut in line. That's really rude. It's not written down anywhere. No one's going to arrest you if you do it, but you will be a jerk, right? So it's inconsiderate. But again, that all depends on context. If you are about to miss your flight, is it ethical to cut in line? People might disagree on that, right? So it's again, everything is context dependent. Do we have any questions on ethics in general before I move on? You can throw stuff in the chat. I'll pay attention to that as well.
If you want to, I know you have a bunch of screens, but if you want to focus on your slides, I have the chat up too, so I can watch that if that's easier for you.
Yeah, that's fine. Okay, move on then. So I have a couple of different cases. I kind of went into the general planning, response, recovery phases for preparedness and response. So I've picked specific aspects of each of these cases that I thought we could look at. So the first is Hurricane Harvey, Harris County, Texas specifically, and this contains Houston. So very urban, suburban, not very rural in Harris County. 4.7 million people, mostly in Houston, were impacted in Harris County. Over 150,000 homes and almost 500,000 cars were flooded in this incident. And that's a huge impact. I don't know if anybody is from Texas or has been to Texas, but you need a car to get around and, get groceries, do pretty much anything in Texas. It's just not designed like New York City, say, in Houston, where you have really easy mass transit and, some people never own a car. Obviously some people don't own a car in Harris, but it's so much more convenient to move around with transportation in the form of, a car. So that was really devastating. Once, even after the water receded, people now are dealing with, obviously, flooded homes and cars. But in the planning phase, Harris County has a really robust planning team. And I chose a hurricane for this because hurricanes are often a problem in Texas, right? So the planning phase is something they should be thinking about. They're predictable. I mean, to an extent, obviously, that any weather is predictable. It's pretty easy to determine if you're going to have a hurricane or not, and when-ish it's going to arrive. And again, because Texas is used to this kind of event, they have a really robust planning team. I took a look at their current emergency plan, and it is like 700 pages and really, really data-driven, which was awesome. And their plan back then was also really data-driven. And their planning team has a lot of different stakeholders on it. It has governmental folks, obviously, emergency response folks, local government, state government. It has businesses and healthcare and all of those things. But then it also just has a group of citizens, a group of residents of the county who have no tie to anything that you would normally link to an emergency response. And those folks are also on the planning team. So there's a really well-rounded group of stakeholders. And one of the things they decided was really important during their preparedness planning was mobile units. And they had these mobile units specifically dispatched to low-income neighborhoods once the water receded. And they provided immunizations, food, water, and then pet food and microchipping for pets, as well as immunizations for pets as well. And so I would love if anyone is feeling like participating. If not, I will fill in the blanks. But if we could think about the ethical principles that are relevant for this planning stage, what kind of ethical dilemmas might have been present, and then strengths and weaknesses. So I'm not sure how participatory we're going to be at 8:30 p.m., but we can try. So if anyone has any thoughts, please do share those. You can unmute, you can share in the chat. Otherwise, you're just going to listen to me talk some more.
I'll take a stab at it, Michelle.
Thanks, Logan.
So I think that one of the most relevant, in my opinion, was the principle of equity. I think that it can be really challenging to, especially in disasters, to service everybody, and especially those, hurricanes aren't exactly selective on who they hit. They kind of hit the whole community. So making sure that even the, low resourced individuals were still getting the support that they needed, not discriminating against anyone, kind of having a all hands on deck, no one turned away sort of approach to it.
Definitely. I think often in disasters, we see that low income communities take the longest to recover for many reasons, but low resources is one of them. And also, directing immediate response to those folks is important because, again, from an ethical standpoint, it is looking at, as Logan mentioned, equity and making sure that folks who maybe don't have the means to have prepared as well or have evacuated and have somewhere else to stay. Instead, we're focusing on the folks who need the most assistance at that time. Not that nobody else needs it, but just who needs the most at that point. Did anybody see any ethical dilemmas? The one that struck me when I was looking at this case, and that actually my boyfriend mentioned, was why are they focusing on pets? Not that animals aren't important and they're not, part of your family, but why are you putting resources towards animals when you could be putting resources towards humans? Any thoughts?
I have a thought.
Yeah, go for it.
Okay. I work in emergency management. I just brought this up because last week was the 20th anniversary of Katrina in New Orleans, and the post-Katrina Emergency Management Act came out, and I think partly what was in there was shelters need to take pets, people need to evacuate with pets, and there was a percentage, I cannot remember it, but it was pretty high. They said there's a high percentage of people, might be 40%, will not evacuate if they cannot go with their pets. So they will just stay at home. So that was a big takeaway. that they learned in 2005 and then 2006 when the Katrina Act came out. So that's why that's so important.
Yeah, definitely. People will put themselves in harm's way to keep their pets who they see as family with them, right? I can't say I would make the same decision, but I do have a dog that I treat like a child. So maybe I would in that moment. Who knows? But that's really important. Immunizations are, also important. There are lots of folks who don't bring their dogs or cats to the vet as often as they should. And then they're in an environment post-disaster where their pet may be more likely to come into contact with wild animals. It's important that they're vaccinated for rabies, if nothing else. So these are things that may not feel obvious. I mean, it wasn't obvious to me, oh, we should have vets as part of the, recovery operation. That wouldn't have occurred to me. Not that I'm in public health preparedness, but that's not something I would have immediately thought of, right? But it's also showing that we really need lots of different folks from different disciplines to be in those response scenarios and planning. Any other thoughts before we move on? All right. So the second case that I was thinking about for this was the Ebola outbreak that happened 2014 to 2016 in West Africa. Ebola is endemic to West Africa, but there are occasional outbreaks that are particularly problematic. This is probably one of the biggest in recent history. Over 28,600 cases and over 11,000 deaths. And in the response phase of this, I mean, there are plans in place for infectious disease outbreaks, but you can only plan so much, and especially when you're in a nation that maybe is resource poor, planning is not as robust as it could be. So there was a slight delay, but then there was this massive international response. Countries sending folks, aid organizations sending folks. In the end, there were almost 200 different organizations in Liberia, Guinea, and Sierra Leone. And they had more treatment beds than patients at one point. By the end, they had just this massive influx of resources. But despite all these resources, there was huge distrust of treatment hospitals, of burial teams, and that meant that folks were treating their loved ones with Ebola at home, probably with methods that were not very effective, not, observing any kind of isolation techniques, right? And then they were burying bodies in a way that was not following any kind of infection protocol. And so those folks were then, they had these graves that were then causing more infection. So even though the facilities were there, they had teams to handle these things, people didn't want to use them. And then they had quarantines that were enforced by the military. And these were often very violently enforced in especially really poor neighborhoods. And so people who were exposed, symptomatic or not, were hiding from healthcare services, from soldiers, because they didn't want to be taken anywhere or forced, to be basically watched constantly by someone in the military to make sure they didn't leave their house. So part of the reason that there was so much distrust is these aid organizations kind of dropped in, built up, and just expected people to show up. There was no community involvement. They may have coordinated with the government at the national level, but that was about it. They didn't work with existing community health workers until later. It was very kind of, I don't want to say white saviory, but it was kind of white saviory where we just kind of dropped in and we're like, we're going to fix this. which caused all kinds of problems related to distrust. And, that was then causing more infection. So similarly, ethical principles related to this, I'll go through this so that we have some time for questions at the end, but, things like autonomy, forcing people to quarantine. Obviously, it's best if people who are exposed are quarantining and isolating, but enforcing that with the military and with minimal communication to folks other than stay in your house because we said so, isn't very helpful. And it can cause people to push back when they don't have the information they need to understand why this is important. Why should I be doing this? Why should I not treat this person at home? Because it's going to make everybody else in the house sick. But if they don't understand that because they hasn't been communicated properly, again, you're just going to have people pushing back against that. So the ethical dilemma in this case was really kind of autonomy versus keeping the community safe. And again, that kind of social contract that we discussed earlier between individual freedoms and then that authority, the government or the military, being able to impose things because they want to keep the population safe as a whole. So there's always going to be, we saw with COVID, we had lockdown, we had these things that we never thought we would be seeing for most people, these mandatory shutdowns of businesses and things like that. And as we saw, there was a lot of pushback to that, but it went better in some areas because the communication was better, right? The information sharing is really important because, again, when you're taking away autonomy, you need to justify that to folks. You need to let them know why, because they also need to decide for themselves whether or not that they feel that that is ethical. And if you can explain your reasoning so that they understand that, it's going to go a lot easier. There's going to be a lot less pushback than if you're kind of just dropping in and imposing something on someone. Okay, the last one I want to focus on was the train derailment that happened in East Palestine, Ohio, just a couple years ago. There were 30 train cars. This is a cargo train carrying hazardous chemicals. You can see there, mostly tankers of different chemicals. So they evacuated really quickly, a couple of hours. They had everybody evacuated within a mile. And then they expanded the evacuation zone. And then a few days later, they told everybody, oh, you're good to go back. We did some preliminary testing. And then a couple days later, they did some more testing and told everybody, nope, you need to evacuate again. So it was really confusing for folks. There was really inconsistent messaging. And that caused a lot of confusion. And again, when people are confused, then they start to not trust things. And in this case, there was a really siloed approach to recovery. So they were doing some testing, by different government labs were doing testing, different private organizations were doing testing, and they were testing for different things. They were not coordinating with each other. So they're duplicating tests, but then also testing for different stuff. Residents were reporting health symptoms and they were being kind of disregarded until they were enrolled in a research study. It's been a very weird situation out there. And this was right on the border of Ohio and Pennsylvania. And so some of these folks are in Pennsylvania and some are in Ohio. And that's added confusion because then you have different governments also working in the mix and they're not talking as much as they could be. So there was a lot of really siloed information and people didn't have the full picture. And so when they were communicating with the public, they were giving different information, which felt contradictory, but wasn't necessarily because it was a different context. So again, this was all about, really confusing messaging for folks. They didn't know what to do when they finally were allowed back in their homes to stay. They were told, if you're on well water, you're good to go. We've tested the groundwater. And then a few days later, they were told, nope, only bottled water. not even a boil advisory, only use bottled water. So again, it was just a very confusing time for these folks who lived in that area. And the ethical principle I wanted to highlight with this one was really that integrity, where, you know, we're talking about being transparent and honest. And again, this is something similar with COVID. Being as transparent as possible, getting people information rapidly when they need it quickly, but then also having the full picture. Because sometimes you'll put out a little bit of information and it seems like you should act in one way, but then you get more information and you realize maybe that's not what we should have done. And as most of you probably recall, you know, and it was similar in this case, that constant changing with new information for those of us who work in medicine or emergency response or public health or any science, really, we understand that everything's going to change when you get new information. Things can change a lot when you get new information. That's a scientific process. We always want new information so we can improve things and how we're responding. The general public, that felt like they don't know what they're doing, right? They're telling me one thing and then they're changing it and then they're changing it again. And it's when you're responding to something that's a rapid event like that, being transparent needs to be, I mean, you always want to be as transparent as possible. You don't want to withhold information. You want to give people timely information, but also you want to have as much information as you can so you can give people a good idea of what's going on rather than just little snippets. So it's something you have to weigh in that, again, context. In that specific situation, is it best to get information out as quickly as possible, or is it best to wait a little bit until you have a more comprehensive picture of what's going on? Okay. So ethical decision making, there are a lot of different variations of this. What are the steps of ethical decision making? I like this one the best because there's a couple of points where you stop and analyze, stop and evaluate. So first you have to identify what the dilemma is. Often, if you're in an emergency response situation, there's going to be a lot of them. So you need to focus on, maybe what's the most pressing. Look at relevant principles and gather information. Again, if it's an emergent situation, you might not have all the information. You need to work based on what you do have. Then you need to propose courses of action and then think about the consequences of each of those actions. Because there are always going to be, unintended consequences in anything that we do in public health or emergency response. Then you eventually just have to pick the best course of action. None of them will be perfect. There's always going to be a downside, but you have to pick the one that works the best and is the most beneficial. And then afterwards, evaluation is so important, because one of the things we want to do always is use a good evidence base when we're trying to make decisions. And if we don't go back and evaluate, we're not going to have that evidence moving forward. So evaluate always at the end. Some additional public health principles you want to consider when you're thinking about ethical decision making. Social determinants of health are very important. A lot of things that you'll think about in public health preparedness, transport is super important, not only, for general public health, but for preparedness situations. Can people evacuate or not? Are the roads going to be clogged immediately and then everybody just sits there in their cars until they run out of gas? Are people going to get really, what was it, Georgia, when people were stuck on the roads and then they got a cold snap and nobody was prepared for it because it was Georgia? That's, things like that happen. So we have to think about transportation. You have to think about education. You have to think about all sorts of different things. Resource allocation is really important. Obviously, we need resources for various things. But often in public health, it's, and an opportunity cost. So if you spend money on one thing, you can't spend it on something else, especially, you know, when governments are making planning preparations. So you have to really think about responsible resource allocation. Community engagement is always best to engage the community, get those different perspectives. They're going to think of things that you don't. Cultural humility, really important to think about the community that you are serving and how they're going to respond to various things. Because one community might respond very differently to the same suggestion. Evidence-based practice, as I mentioned, always we want to be evidence-based. We are not always going to have a robust evidence base, but we should be using evidence-based practice whenever possible. And then finally, advocacy for specific policies, for programs, for individuals, for groups, whoever we feel needs that advocacy. You know, we see disasters happen all the time, and we realize if something had gone differently, more, you know, there could have been a better response. We could have, you know, had less damage, whatever it may be. Wildfires, we see that all the time. You know, there are different mitigation efforts we could be using, but we're not. Advocating for those kinds of things is very important. And I think that's all I've got. I have a couple minutes left for questions. I ran through that quicker than intended, but I think we're good. So does anybody have any questions?
I've got the chat open, so if you want to type it in there, you can I can read it for you, or feel free if you'd like to unmute and ask Michelle directly.
If you really want to come and enroll in the MPH program, I'm also free.
Wait a second.
Come do that. No, I'm kidding.
Wait a second. Obviously, you wouldn't want to leave the PHP program.
No, you would not. Well, you could get a public health certificate.
There you go.
And our public health students who are on the call, you can get a PHP certificate.
We would love to have you, or we do have PHP classes that a number of public health students take as electives. So that is always an option as well.
Yeah, we have quite a few students who use their MPH electives to get the PHP certificate.
I think thank you so much for doing this. And I think this is great because it's really important to think about. And even, I mean, the case studies that you provided were all so important, and they're not like oh my God, Hurricane Katrina and everything has gone wrong, like we're going to talk about in the book club, like we talked about in that 410 discussion forum. And I actually use the examples that in my Coast Guard world, I use Ebola and the East Palestine train derailment as a way of, I mean, we're talking about the CBRN program, the ChemBio RAD-Duke program, and Ebola and that train derailment are both things that the Coast Guard did respond to. So, you know, when we're talking about our CBRN program, everybody automatically thinks of WMD and, oh, the big nuclear blast. And I'm like, well, no, it's not that. It's the coasties at the airport responding to Ebola. And it's, you know, the train derailment, which is a hazmat release, which is, you know, our people are responding to that. So, you know, these ethical things, I think sometimes we think about in the context of those huge things that in those huge disasters, but it can just as easily be the train that derails and, you know, on a Tuesday afternoon and everybody, you know, needs to run out. So I love being able to present that, well, having you present it, and just to get this awareness and to further these conversations, because in the Homeland Security program, we do have an ethics course that they have to take, but it's Homeland Security ethics. So public health is touched on a little bit, as are the other fields, but you know, it's really great to be able to kind of focus in on this and see this different ways that that this can be impacted. Hey, Julie, how are you?
Hi, I'm good. Sorry I was a little late, and you may have talked about this, Michelle. I thought this was interesting, so I look forward to seeing the recording if there is one. but
Yes, there is. I'll make sure you get it.
Okay, great, great. Yeah, I was just thinking about mostly because like my husband was very closely involved in response during COVID, and I learned a lot about just kind of anecdotally about how public officials, public health officials specifically, address misinformation. And so I just wanted to see, especially given our current federal climate, like what your thoughts are on how the responsibility or the ethical responsibility of public health officials to address misinformation and disinformation, particularly when it targets specific minority or immigrant communities, and in light of preparedness and response, if that makes sense.
Yeah. Yeah, that's tricky. And it's something I've talked about with students before is, it's easier to address misinformation because that's just folks not understanding or getting something weird. And it's not intentional. It's just, usually in those cases, with effective health communication and health education, you can kind of help folks to see the reality of a situation, and that maybe where they got that information from wasn't reliable, or maybe it was misconstrued a little bit, it was interpreted a little bit wrong. So you can help folks to understand. With disinformation, it's a lot harder, with folks actively trying to, create problems essentially by creating new information that's wrong or intentionally targets specific groups. That's really difficult. And it can be really difficult to approach in a way that doesn't cause more conflict and more kind of reinforce some of the negative things that are coming out of it. I still think the best approach is, using effective health communication methods, but also I think as public health practitioners, we have to understand that some folks are not going to ever come around. They're not. They're going to continue to disagree with you. They're going to continue to believe that, something made up is the right thing. I mean, we have people who are very adamant that the earth is flat, right? You can't reason with that person, right? You can't logic them out of it. It's kind of cut your losses. Okay. Obviously that's more problematic when it's something that matters to day-to-day life. If you believe the earth is flat, that's not harming anyone. I'm frustrated with you, but it's not harming anyone, right? But if you believe that, there are microchips in the COVID vaccine, that is actively working against public health efforts, right? The best you can do is provide information. Getting combative, which eventually you get frustrated and you start to get a little combative, that's not helpful, because it's just gonna make people defensive and kind of dig in more. Really, all you can do is try to, as neutrally as possible, provide information. And if they are not willing to listen, there's not much you can do, unfortunately.
Yeah, I think neutrality is a great point, and also your earlier point about the officials kind of are getting new and emerging information, and kind of just reinforcing to the public that that information changes. Because I think back to COVID and the hand washing. You may have talked about that, but I remember the hand washing guidance, and then we realized that was something that they were learning on the fly as well.
Right.
So yeah, very good. Thank you so much.
Yeah.
So going off of that point, early-ish in COVID, Jean and I were working with another department at Penn State on a education module on COVID. It was broken down. I think it was like science, something, and public health. And one of the professors that was working on it said this has resonated with me since the words came out of his mouth, and I have repeated this a million times. but he said that one thing that was so difficult about COVID for everybody is that there have not been major not advancements, but like cancer is cancer. And yes, we have advancements when it comes to treatment or to different therapies and things like that. But our basic understanding of cancer hasn't changed in people's lifetimes. The the flu and diseases as we understand them haven't changed. With COVID, all of that was thrown out the window because it was a novel disease. So we were learning things on the fly, and we would learn something and then we would learn something new, and that's just not the way people today understand and have any experience with diseases. And even though we were saying things like a novel disease and things like that, that point really wasn't hit home. So it did look like flip-flopping and it looked like changing every day, but it was changing every day because it was changing every day. And we were learning more and more about this disease that we knew nothing about. And that was just, when he said that, it made perfect sense. And it was like, that was just the part that we needed to, better articulate to people. But yeah, I mean, I was, when you talked about microchips and vaccines, I read a fascinating article during COVID. And I believe it was a scientist who did work with microchips. And he took the argument at face value and he was like, okay, vaccines do not have microchips in them, but let's explore why they don't. He didn't just blow it off. He didn't say people were crazy. And he broke down microchip technology. Like, I am by no means a microchip scientist, so there's no way that I would have understood it if he was delving into his technical world. But he broke it down like, okay, the largest needle that they give a vaccine in is this big, and the smallest piece of a microchip is this big. And his whole argument was, I wish that I could make a microchip that could fit in a vaccine needle. Because if I could do this and I could do this. And there are so many things that we could do in this field, but we can't because it's not possible. And the article is just great because he wasn't calling people crazy or anything like that. Going back to your neutral stance, he was like, okay, let's look at this argument and let's break it down and let's explore it. And it was really interesting. And also, I was talking about talking to people. My son has been really interested in the YouTuber Dr. Mike. And he does an amazing job breaking down, especially misinformation. He does do some disinformation, but one of his YouTube videos was him against, I believe it was 20 anti-vaxxers.
Yes.
And that was fascinating. Like, he went into the room and he gave everybody the time to talk and to ask their questions. And even if they didn't fully come around to, oh my God, vaccines are the best thing since sliced bread, I'm gonna go, go get a bunch. You could see the wheels turning, and they were at least willing to accept that maybe there's something to this, and maybe there's something that either I didn't understand or that I was wrong about, and this is definitely something that I need to, to think about some more. So
yeah,
when I first saw the title, I was like, whoa.
Yeah, no, what I really liked about, I saw that too. One of the things I really liked about his conversations was when he was talking to someone who was really just, really, really combative with him, he would stop and say, how could I explain this to you? Is there anything I could say? Is there anything I could say that would change your mind? And if the answer is no, not much you can do. But if they say, well, I need evidence of X, Y, and Z, okay, great. I can meet you where you're at and provide you with that. And I think that's a good way of asking, what could I say that would convince you? And it's a fairly neutral statement. It makes them reflect on themselves. And sometimes that's all folks need, is to think a minute and be like, what could you say that would change my mind? I mean, as many people did, experienced that with grandparents during COVID who didn't want to get vaccinated. And it's actually really funny that you say that about the needles, because I literally brought my dog's microchip needle in and I was like, look at how big this is. Like, you can't do, like, if they're hitting you with this, then yes, be worried. Like, but it's, yeah. So it's, I think meeting people where they're at is very, very important, as always.
Yeah, and going off on that, I know we're kind of going from ethics to comms and kind of going back and forth, but it's always interested me when people talk about, especially the vaccine debate, and obviously there's way more to public health than just vaccines, but since we're here, and people talk about the greater good and everything like that. But so many of the anti-vax arguments are so focused on, well, I don't want that specific thing injected into my child. Okay, so if that's your concern, you don't care about, the thousands of people that you interact with. Your concern is that specific vaccine, what's in that vaccine, and the science, maybe not the science because that's too heavy, but you need to know that this is safe to inject in your child. If I could talk until I'm blue in the face about the greater good, you need to know that that is safe, that, and that your child will be safe after they get that injection. Not that your kid won't go out and spread some sort of horrible disease. So it's been interesting to see some of how we've come to that, but also how we still have some of these major disconnects where the conversation is greater good, we need to protect everybody. And there are people that are like, but I'm concerned about this chemical. And we've gotten there in some places, but we're not there in others.
Yep, definitely.
Are there any, I know we're about 10 minutes over, but does anybody have any questions or any comments? I know that topic of comms and vaccines and public health things could be an all-nighter.
Yeah, we don't want to go to general public health questions. We'll be here all day.
Okay, well, thank you everybody for coming. Michelle, thank you so much for doing this. We really appreciate it. If you are available on the third Monday of the month, it sounds like some of the ethical questions that you brought up tonight would be great in our Katrina discussion and our memorial discussion. But thank you so much for coming and doing this tonight. And I am going to share this link after I get it. But again, PHP webinars, first Monday of the month. Next one's October 1st. IAEM meeting, second Tuesday of the month. Next one's on the 9th. Book club is the third Monday, so the 15th. And if you are interested in that mental health event, and if you would be interested in writing a white paper, please let me know. Save the date for November 3rd in DC if you are around. And I will also be sending out the link for the flu shot drive in Lebanon, Pennsylvania, if you are interested in participating. So hopefully I see you at any of those dates that I just mentioned. But thanks again, Michelle, and everybody have a great night.